The first thing that I want to tell you is that you don't understand dry eyes, at least not in any meaningful way. And I'm going to explain to you why that is in just a minute. But first, welcome to the channel, all about eyeballs. I've stood here across from you speaking to other women and men about dry eyes many, many times. And if you're like they are, you've searched everywhere for expertise, and more importantly, you've sought out a plan for making your eyes feel better. You've scoured the internet for information. You've read lots of articles on dry eyes. Perhaps you've delved into scientific journals that explain in detail the intricacies of dry eyes. Most likely, you've been to see your eye doctor. I hope you have, but maybe not. Heck, perhaps this is the first time you've found any resource about dry eyes at all. At any rate, your eyes sting, burn, feel gritty, feel gummy, or counterintuitively, water too much, and you're seeking answers. You're looking for a reasonable explanation to why are my eyes dry, and what the heck can I do about it? Well, you've come to the right place. I'm Dr. Mike Vernon, and I've been practicing optometry since 2001. I'm a fellow of the American Academy of Optometry and a diplomate of the American Board of Optometry. And over the years, I've helped scores of patients with their myriad eye complaints and diseases like glaucoma and macular degeneration, blurry vision, scratched corneas, pink eye, cataracts, and dry eyes. Do you know what eye condition is the most demanding to manage? A detached retina? Diabetic retinopathy with bleeding inside the eye? A metallic foreign body in the cornea? Indeed, no. I'm sure you know the answer. It's dry eyes. This is why it's so difficult to understand dry eyes in a meaningful way. Dry eyes, or dry eye disease, yes, it's considered a disease, is the most complex, the most time-consuming, and the most patience-requiring eye condition to manage, both for me, the doctor, and for you, the patient. By far. I tell you this not to discourage you. I share this fact with you to help you understand why you're here. I know why you're still seeking knowledge about dry eye disease. It's because information on dry eyes is super hard to pull all together, to explain it clearly, to take the time to be sympathetic and not rush you out the door so the next patient can be seen, and to be clear with an explanation of the treatment plan. This is why your eye doctor may not have given you all the instructions and tips and recommendations you need to properly care for your dry eyes. It may be because your doctor didn't have a deep knowledge of dry eye disease, or possibly your doctor simply didn't have the time to share it all with you. Dry eye disease is so multi-layered. The tear film that coats your ocular surface is an elegant and complex thing. Human emotions that have been frazzled with the search for dry eye solutions are deep and real. Managing dry eye disease demands office time and can involve a score of tests and tools and kits and questionnaires. And a treatment plan calls for months, not days or weeks, of consistent adherence to it every single day. Consequently, do you know the eye condition that is the most rewarding to manage? When a person becomes educated to the facts of dry eye disease, when the light bulb goes on regarding its complex causes, its anatomical intricacies, and its proper management, when frustration begins to wane, and when hope enters, and when dry eye symptoms finally start to improve and get better, can you imagine how that feels? Oh, wow. After a few months of interacting with a dry eye patient, seeing her beaming face in the chair across from me, that is pure joy. Well, Now it's time to learn about dry eye disease. It's time to dedicate the time to a complete discussion about it, to understand dry eye disease in a meaningful way. It's your turn to get answers to questions about dry eyes that seem to be elusive, to understand what's going on with that oh so fancy tear film, to enhance a treatment plan that your eye doctor provided you, but may not have had the knowledge or time to sufficiently instruct you on how to do it well, on why you do it, or with what products. Now, before we get into it, just a quick word about our relationship. Of course, you're not my patient, and I'm not your doctor. I can't know for sure where you're at on the spectrum of dry eye disease. You may have emergent dry eyes, or mild dry eyes, or moderate or severe. I don't know. But what I do know is that the therapies I'm going to outline in my next videos are therapies that everyone who experiences dry eyes should be doing. They are foundational. They are fundamental. They are cornerstone dry eye therapies. The measures that I'll go over in the next videos are the measures that I always instruct my own patients to do. These therapies have helped many people get relief from dry eye disease. And if these action items are enough to manage your dry eye symptoms, then these basics may be all that you need. We're going to go over a ton of things in our discussions about dry eyes in the next videos I'll be releasing after this one. And the more we talk, the more things are going to make sense. But before we do, I want to give you an abbreviated outline of these dry eye therapies, just so you know where we're going before we delve into our instruction on eye and tear anatomy. These are some of the therapies that you may be doing now. They're non-prescription, home-based dry eye therapies that can be done alone, independent of other prescription and in-office therapies. Or they should be supporting therapies that enhance prescription and in-office therapies. They are the fundamentals of any dry eye treatment strategy. They are generally arranged in the order of when you would do them first during the day. They're in the description below, this abbreviated outline that I'm sharing with you. And one final thing. Thank you for your eyeballs.